delegates. We will be presenting our findings on comparing peripheral refraction, financial disclosure. I am a advisor to SLR Private Limited. So myopia prevalence, we have enough of data now that myopia prevalence has been increasing dramatically throughout the globe, whether it is India or abroad. And the uniqueness of myopic eye, how it is different from hyperopic eye, is that it has a longer anterior-posterior length, which means that the axial length is longer than the equatorial diameter, which is not there in the hyperopic eyes. Now, how does it transform into peripheral refraction? The peripheral refraction along the horizontal meridian in the myopic eye would be more hyperopic relatively because the axial length is long. Now, it is known that peripheral retina influences the ocular growth. There is a
slides and
what is going on?
Moving.
What is wrong?
Yeah.
But I am not able to see the slides. मियाँ चेक करने का टाइम नहीं है, स्लाइड्स दिखाइए, यहाँ नहीं दिख रही हैं, आपने टाइमर चला रखा है.
He's not able to see slides.
कंप्यूटर में स्लाइड्स नहीं दिख रहे हैं.
यहाँ नहीं दिख रही हैं भाई.
It's seen here. It's okay.
So the myopic prevalence we talked about, what I was saying was that, you know, the uniqueness of this particular eye size, what it does is that it changes the peripheral refraction along the horizontal meridian of the myopic eye. Whereas it is now known that the peripheral refraction has been implicated in the growth of eyeball more than the central refraction. So the earlier view was that it is the central refraction which corroborates with the growth of the eyeball, and now after this wonderful article by Earl Smith, we have now known that the peripheral refraction is actually responsible for the progression of eyeball. So we did our study to measure the peripheral refraction, and how did we do that? We made a peripheral refraction aid which we implanted on the retinoscope, and this could actually measure the peripheral refraction for 20 degrees, and we measured this for most of our children. All our children were between 5 to 12 years. We included all the children who were cooperative enough for the peripheral refraction test. Children with cylindrical power of less than 0.5 diopter were only included in the study so that there is no confounding bias. Children with history of prematurity, ocular pathology, systemic ill health were excluded. We already had these patients on our roll. We had the standardized 1-year spherical equivalent so that we have the axial myopes which are to be included in the study. And the primary outcome measure was obviously to see the peripheral refraction of the eyes. And the secondary outcome measure was to calculate the difference between progressive myopes and non-progressive myopes. For the sake of comparison of this particular study, we only took right eye to avoid any confounding bias. And what we found was that the mean difference between the temporal and nasal refraction in a progressive myope was 0.7 diopter and 0.6 diopter, whereas in a non-progressive myope, so a progression, who is a progressor? A progressor is a patient whose power increases by 0.5 diopter in a year, or 0.2 millimeter axial length increases in a year. So peripheral refraction has now been known to be one of the major risk factors for increase in the growth of eyeball for childhood myopia. Multiple studies are there for myopic patients having hyperopic peripheral refraction. Our own LVP has presented their data where they found that Indian myopes had an asymmetric peripheral refraction. But the most important point is that a direct study to evaluate the peripheral refraction in myopic progressors, because we all have data, we all have treatments only for progressors, not for non-progressors. So progressive patients do have peripheral hyperopia, and our study shows that children who show myopic progression have a peripheral hyperopia of more than 0.5 diopters, both nasally and temporally. So the conclusion, the crux of the matter is the children who have myopic progression have higher degrees of peripheral myopia compared to non-progressors. The peripheral hyperopia of more than 0.5 diopter at 20-degree periphery, you can have more, you can calculate for more peripheral data also, but this could be an indicator for progression. But what we still don't know is whether the reverse is also true. More studies are needed to know if children with 0.5 diopter hyperopic refraction would progress. So how it would help? It would help if you already know that this is a patient who has come to you and you have done peripheral refraction and he has got more than 0.5 peripheral refraction, whether this particular patient will progress or not progress. So that would need more studies. So thank you so much. And these are the references.
Thank you, Dr. Jitendra. Actually, in spite of that technical issue, finish it on time. So, I mean, peripheral refraction is an important part for checking for myopia progression, and I think it's a very novel way of actually judging it.
And-
So, thank you. Thanks a lot. I'll invite
And the
Dr.
device
Aditya.
works very well. He comes with all that. I'm new in